Good day everyone, I'm Angel Clyde Malabag, and in this video, I want to demonstrate how to perform medical hand washing and open gloving. So before anything else, let's talk about why it is important for us to wash our hands, especially before and after patient care or after coming into contact with a body fluid or open wound or touching something close to the patient like a bedside table or the hand railing on the bed, or after removing your gloves, before in eating, and using the bathroom. Removal and killing of microorganisms in order to reduce the risk of its transmission or cross-contamination among clients is also done in order to reduce the risk of getting ourselves infected by these organisms. So before we head onto the hand washing procedures, we of course need to determine the location of running water and prepare our equipment. So our soap is right here, and I also prepared two pieces of disposable sanitizing towel. Next, we have to assess our hands. It is extremely important to keep our nails short, as long nails could not harbor microorganisms and are likely to scratch the client or puncture a glove. Remove all jewelries and check the hands of breaks in the skin such as hangnails or cuts. So let's go ahead onto the hand washing. Turn on the water and adjust the flow. There are 5 types of faucet control: hand-operated handles, both knee lever, breast foot, elbow control, infrared control. But for this video, we are just gonna be using a hand-operated faucet. If your faucet has a temperature setting, make sure to adjust it to warm. Next, we're just gonna wet our hands. The hands should be held lower than the elbows so the water flows from the arms to the fingertips, because we don't want the germs that are already in our dirty hands to travel up on our arms. After you wet your hands, you want to apply your hands soap, about 2 to 4 ml, and lather our hands and wrists. We're gonna scrub this up on our hands using circular motion, because this is going to help to remove those germs and the things that are sticking to our hands. And we want to cover all areas of our hands, especially those small crevices, because that's where bacteria like to hide. We're gonna do this for 20 seconds. Then we're going to get back of our hands. Then, we're going to do our thumbs and each finger individually, making sure we are getting around the fingernail area as well. And then, you want to get those and then you want to get those knuckles. So really rub the knuckles up against your opposite hand. we're going to pay attention to our fingernails. Next, we're gonna get our wrist and go about 1 inch above the wrist as well. And now, we are ready to rinse the soap off. So, we're going to put our hands underneath the water and let the water go downward. We don't want it to go upward, rinsing all the soap from the wrist down to the fingertips. Once you get them rinsed, you want to make your paper towel and you're just going to pat your hands dry. We're going to discard this wet paper towel. Then we're going to grab a dry paper towel and turn off the faucet. Being careful not to touch the faucet with our clean hands, and then we're going to discard this as well. We wouldn't have used our wet paper towel to turn off the faucet because the germs that are on the outside of the faucet could have transferred through that wet paper towel and got onto our hands and undone the job of what we just done with cleaning our hands. For the open gloving procedure, first what we're going to do is get your sterile gloves. Sterile gloves come in different sizes, so be sure to pick the correct size of the sterile gloves. If you're a man, you'll probably need larger gloves. They come in small, medium, or large, or they're labeled with a number, and these are size 7.5. Next, what we'll do is you open your sterile gloves, unfold it, and when you unfold it, you will see these little creases around here. This is for you to open them without contaminating them, the gloves, so what I like to do is I like to take my fingers and I like to reach underneath and grab these little flaps right here so I can pull them open, and remember, you have 2 inches to grab so you won't contaminate the field and flatten it out. Next, you'll want to glove your dominant hand. I'm right-handed, so I'm going to go up my right hand first. So what I'll do is I'll get my left hand ready to glove my right hand. I'll take my fingers and I'm going to grasp this cuff right here and grab them like that. And I'm going to keep my thumb tucked in because this will allow me to slide the glove a lot easier without my thumb getting in the way. And if your thumb gets in the way, you may touch the outside of the glove and contaminate. So
keep it tucked in. I'm just going to take my hand down in the glove, just pull it up, and I'm pulling it with this, and it's okay to do that. Pull it up your arm and make them fit better. So now we're going to take to glove our left hand, and we're going to take our right hand, and we're going to go underneath this cuff instead of grasping like we did before. We're going to go underneath it. We- We're going to keep our thumb instead tucking it in. We're going to keep our fingers together, and we're going to slide the glove up through those fingers. Push the other hand with, and now we're going to tuck the thumb under so we can slide the glove. Sometimes the glove will be little twisted and messed up. So you can take your hands and you can just fix them and make them more comfortable to you. We now have our sterile gloves on, and usually what happens is that your face will itch or patient will need something. Do not touch your face, don't touch the bedside table, don't touch the bed, don't touch anything, because if you do, you'll have to repeat this whole procedure over again and put sterile gloves on.